Hi everyone, good evening. Obviously you'll be able to tell I am not Australian. I originate from Scotland. So thank you very much for having us tonight. First of all, I would like to acknowledge of country. We acknowledge the Noongar people as the traditional owners and custodians of the land in which we work and pay respects to elders both past, present and emerging. North Metropolitan Health Service recognises and respects and values Aboriginal cultures as we walk a new path together. Thank you for that. So obviously, Amy, thanks for asking us to be part of your panel tonight. Part of our role as social workers here at Charlie's, we would just like people to actually understand our role and try to dispel some of the myths that some people often have about social workers and why we get involved with people. So obviously I've got Ivan here, who is currently our social worker up on the renal gastroenterology and the transplant ward. I myself have worked there in the past 7 years. And obviously Sally here is our clinical nurse specialist who deals in the supportive pathway clinics and pre-dialysis. So hopefully together, the three of us will be able to provide you with a whole host of information, knowledge and resources that you may be able to tap into. Thank you for that. So we have put together some PowerPoint slides. Obviously, we'll go through some of the important parts of the slide, but what we want to focus on is that you'll be able to go back and review that and read for your own time any information we may not have touched on tonight. So I will hand you over now to Ivan, who is going to introduce the PowerPoint to you.
Nice, thanks, Alison. Good evening, everyone. So I guess this is a good starting point to look into the social work role within a healthcare setting. And I think a good way for us to look into that is to look into the social determinants of health, which is highlight how someone's social and emotional well-being could impact on the overall health of health. Some of the things that are relevant and highlight the importance of social work to be involved in your care is, for example, someone's socioeconomic status could have an impact on their health well-being. So, for example, if you have lower access to employment or income, that could lead to, let's say, poor nutritional intake, that could lead to poor health outcomes. For example, that would mean financial ability for appropriate nutritional intake in the dietary, which is quite important for PKD patients. We also acknowledge that, patients who might come from a culturally, linguistically and diverse background might have poor health literacy, for example, due to their language considerations and also access to interpreter and things like that as well. So what is the role of social worker on the renal space? Do we only just process and fill applications, or are we able to offer more care and support for you? So this is an overview on what we do, and we want to acknowledge that the scope of social work services differ slightly between a tertiary hospital setting and social workers you might encounter in the community as well. And the level of social work involvement can vary depending on your individual circumstances. So you could have one singular episode of social intervention, or at times you might have ongoing, quite frequent input from social workers looking to ongoing assessments, planning together with you on your care, and providing emotional support when appropriate. So some of the, a highlight of our role is we look into someone's psychosocial well-being and, for example, addressing all aspects of your life. We provide emotional support, encouragement and supportive counselling. And more importantly, we also help with the adjustment and the coping of your journey to go through the PKD and any associated impacts to your daily living as well. We provide linkage and information regarding what support you can access in your community, and also we assist with advanced healthcare planning. And I think a value that social workers can add to your healthcare is we have the knowledge to obtain a holistic and comprehensive understanding of your individual and how you interact in your environment, and focus on your physical, emotional, and social well-being for that as well. And the other highlight that we normally do for social workers is we want to highlight your strengths and we want to highlight the resources that is available to you. So if we're looking to within a tertiary healthcare setting, we also have access to welfare officers who have incredible wealth of knowledge, which work in partnership with a hospital social worker to provide information, assistance, and advocacy to access financial and accommodation support. So this could include, for example, the navigation of Centrelink, payments eligibility criteria, and the application processes. It could look into education on consideration to access early access to superannuation or any other available financial support like the hardship utility scheme or the no interest loan scheme, which we'll talk about a little bit more in the presentation as well. And depending on the organisation that you might come across other social workers, you'll often find social workers might also help with providing financial support or welfare officers within a tertiary health hospital setting as well. So what are we actually looking at as social workers? So we were looking to what we call person and environment perspective. So we recognise that a person can be better understand within their different environment that they're operating from. So some of the examples that we're looking into, for example, we look into intrapersonal, interpersonal, and environmental. But what that really means is, so when we have sort of assessments with our patients, we look into how they are functioning. So, for example, how would they provide their manage your personal care, things like showering, dressing. What is your mobility looking like? Have you have any chronic pain issues or limited by pain with your PKD? And would you need any mobility aids and support in that regard? How are you managing your medications? For example, whether you have any concerns or with your cognition or memory, and also you're looking into how to support you both your emotional well-being, like a coping mechanism as well. Besides yourself as an individual, we also look into your interpersonal elements. So what they look like is we want to look into your immediate and extended family network, so your friends, your partners, your children, and how that might impact on your healthcare. But more importantly, looking into the role that you might play amongst the family, whether you might be a caregiver for someone else's, or maybe you are a care recipient from someone else's, and look into that family as a unit as well, and acknowledging the role that carers play in your care, as well as the family functioning and the dynamics within a family as well. Another thing that we always also look at from a social work perspective is how someone interact with the environment. And what that means is, what's your home environment going to look like, whether there's any stair access, for example, or any sort of steep climb to access your home that might prevent you to access healthcare or going to see your GP and doctors. And also, how would you, let's say, complete your domestic duties? So, for example, things like meal preparation, going for shopping, doing gardening, even more importantly, transport, for example. And we're also looking into, how would you manage your finances, which we know is a really hot topic at the moment with the increasing cost of living, and also looking into, whether we can help with support you to have access to a shelter like safe housing as well. We have a really sexy graph right here, which looks really complicated, but it's actually the one.
Ivan, sorry to interrupt you there. Can you just move that speaker a little bit closer to you?
Sorry. Yeah.
No, that's all right. I just think it was just cutting in and out a little bit.
No worries.
Thank you.
Yeah. So this is a graph that we've is sort of found from a journal article in the UK, exploring the role of the UK renal social worker working with patients who are living with chronic kidney diseases or with PKD patients as well. It's just want to highlight that it is sort of catered towards the UK healthcare systems. You might see terminologies that might not be directly relevant in our Australian healthcare system, but I just want to give you a really brief overview on the 8 domains that we normally found renal patients might experiences and how social work add value and support through their care, which we would talk a bit more deeper on some of the key ones that we find from our experiences working with PKD patients. One of the primary one is what we call activities of daily living. So that is looking into how your physical health can impact your lifestyle. So we understand that PKD patients often might be experiencing of chronic pain or heaviness in their back, sides, and abdominal area. And this pain could limit your ability to, let's say, navigate your everyday activities. So one thing that we look at is whether your eligibility and access to healthcare support. So there are a range of government funded support available to you across Australia. If you're over 65, then you might be eligible for My Aged Care home support. Or the eligibility criteria will be anyone who is over 50 for Aboriginal and Torres Strait Islander patients. Whether you might be,
Yeah, it's just,
Yeah.
I think it is just cutting in and out a little bit. Or, I mean, oh, no, look, I've had feedback from somebody else that their sound is fine. So that's okay.
Yeah.
Then I will assume it's only my end.
No worries. Please let me know if you can't hear me clearly. But yeah, so besides My Aged Care as well, social workers get often linkage with support with other government funded support. So depends on eligibility, you might be able to receive support with NDIS, or if you are a serving member, past serving member, home care support under that home care program as well. And if we can move to the next slide, if that's all right. Oh,
Sorry,
thank you. That's okay. Thank you. So with social workers as well, I think the other thing that acknowledging the importance of access and community going through to treatment, or if you are needing dialysis, for example, we can provide linkage with you through different transport options, which is essential for you to access specialist treatments. Some of them linkage that social workers can help facilitate is, for example, your local hospital volunteer or patient transport, any available parking subsidies that could be available to you. So, for example, our dialysis patients on our ward are eligible for subsidised parking for $5 a day. So that could be, if applicable to you in your local hospital. It is something that we're double checking, especially given the nature of chronic disease management, whether you might be able to access to cheaper parking. And we can also provide linkage with Australian Disability Parking Scheme right here in WA. It's called the Parking Permit, and it's available to any patients who might be experiencing or have severe implications to their mobility. So, for example, for patients who might be in the pre-dialysis or receiving dialysis stage when their PKD progresses, if they're experiencing severe functional impacting on their mobility, such as fatigue or breathlessness, they might be eligible for this parking scheme that social workers can help you to link up with. Along with that as well is the taxi user subsidy scheme, which I know they come with different names across different states, but essentially it's for patients who might be to get up to 50% off taxis, fares back subsidies up to $25 right here in WA that we can tap you into either from social workers or welfare officers as well. So that is something that we can provide this practical support for you managing the chronic nature of PKD. Alongside with that as well, we also provide support working in collaboration with our colleagues and the medical team and nursing staff to provide information, guidance about available housing support. One of the things to highlight is acknowledging the current day and age where we're in a rental crisis. We have a lot of psychosocial, worries about housing, and social workers in most cases, we don't have access to separated or dedicated pot of funding to house someone, but we are exploring and providing you assistance with what other available support that is available out there in the community, and we'll advocate for you to get onto the wait list and access those support. So some of the key, challenges that PKD patients share along our experiences is we can provide assistance with, for example, patients that need to apply for public housing, if they meet the eligibility criteria, or if for patients who might be currently a resident of public housing, if they're looking for a transfer for different accommodation on reasons such as, mobility-wise, it's getting harder for them to go up and down the stairs. We can advocate for and assist with transfer applications. Social workers can also sort of provide linkage and knowledge of raising cost of living as well. If you are at risk of maintaining or sort of at risk of homelessness, we can provide support. in looking at other social housing options, but also looking into, in those circumstances, crisis accommodation for you as well. And we know that accessing specialist treatment such as rheumatologist is often could be a limitation for country-based patients. If you need to look for semi-longer term accommodation for you when you're accessing treatment in metropolitan areas and cities, social workers often play a key role in those relocation as well, but also tapping you into the local patient assistance transport scheme for regional patients. The other big barrier that we want to highlight is financial concerns, and we understand that some of the PKD patients might often stress about, whether or concern about the impacts on their capacity to continue employment, or worried about the possible loss of employment, especially for carers when they have to provide care for their loved one living through PKD. So we know that's often also complicated by if there is a mortgage for your family as well, or any additional childcare support if you have children amongst your family. So how we can help as a social worker, welfare officer point of view, so we can provide you with information and linkage to explore different kind of financial support. So some of the bigger ones that we highlighted on the slide are whether you might be eligible if you have income protection under your superannuation, tapping into your local or your state-based no interest loan scheme, where you can apply for eligible low income earners up to $2,000 in accessing medical or dental treatments. Whether if you are at risk or really struggling with paying for utility bills, there will be your local relevant in WA. It's called the Hardship Utility Grant Scheme, where you can organise payment plan and financial support if you are behind on your essential utilities such as electricity, gas and water and things like that. And the other thing that we often come across is for patients, especially who have a lot of chronic medications, we can always give you information highlighting whether you might be eligible by talking to local pharmacists about whether you could access your PBS safety net scheme as well. And another good resources we often tap patients into with chronic disease is whether you can have refer you for free access or a consultation with financial counsellor, or even at your local Centrelink offices. There are financial information service officers who can provide you with guidance about what you can eligible to access or what financial assistance you can obtain as well. We want to highlight that social workers generally are not financial counsellors, so we can't give you information on what to do with your money or whether you should sell or buy shares, but we can provide you linkage really to people that are professional in the area, or we can be the facilitator for you to see what is available out there in the community, just to help out to manage the cost of living, cost of medications when living with PKD.
Yeah, so one of the biggest concerns is that we have people with obviously renal disease, and they have sometimes get carers. So their wife, husband, son, daughter, end up providing a very supportive carers role, and often don't recognise themselves as carers. So it doesn't matter, you don't need to be fully hands-on providing showering support, or, you could be doing transport support, having to provide shopping, having to prepare meals, that's a caring role. And as such as that, you could be entitled to a carer's allowance. So there's two different types of carers payments. So here in WA, we've got the carers payment, which is if you are constantly caring for someone. So that's when you're full on, providing care multiple times through the day, or even through 24-hour care, that you can actually get the carers payment. As you can see, we've put some of the payments up. So that $971.50 a fortnight for a single person providing care, and for the couple it's $1,464. Now, obviously, you're not able to work, so you're not able to employ, so that's obviously to support you financially while you're providing your carer's role. The carer's allowance, again, is for people who are still able to work but providing some level of care. It's a no asset test, but I think as long as you don't earn over $250,000 a year, which I don't know many people who do, but that you may be entitled to this $144.80 a fortnight. Now, I know it doesn't seem a lot, But if you're running back and forth to the hospital 2 and 3 times a week for treatment, it can help with fuel. It can sometimes support with the medication costs. You know, it's there to provide some assistance financially. So it's just to be aware that some people didn't realise that there is 2 different types of carers payments. So it's just to make it quite clear. So, and you can apply for both. So the eligibility criteria is obviously you'll fill in the details in your Centrelink application, and you need a medical report from the doctor, which our doctors here have no hesitation completing, and we're able to process that quite quickly and give that back to the patient to put through to the Centrelink. As well as that, from Centrelink, you know, you can get access to additional subsidies for electricity. So there's other parts of that if you're on a carer's payment that you can actually access to. So please do look into it and check your eligibility criteria. If you go on this the MyGov page and go into Centrelink, it actually talks you through all the different criteria, and you might actually meet that. And always apply. You'll never know unless you make the application. So that, just wanted to highlight that to you. So again, the social supports and the carer support. So we here, as well as focusing on the person with the health condition, part of our role is supporting the carers or another loved one, because although the person's going through the illness and their treatment, the family's there and the carers there going through that with them. So we need to make sure that all aspects of that family life feel supported and know that we're there to support them through it. So we have social networks, we've got community engagements teams here. For carers especially, we always encourage people to link in with Carers WA and the Carers Gateway. So that is it's a free service. There's no cost to registering with these services, and they provide a lot of input to support carers to continue to be able to fulfil their role. So that's a really good support. It offers counselling support. They can offer sometimes financial assistance. They can offer respite if, you know, if a carer's themselves having to get into hospital for some treatment and the person's at home, they can sometimes provide some respite. So they can provide carers to come to home to provide that respite, to allow that carer to have their treatment or whatever else they're having done, some time away at the shops or the hairdressers or whatever. Obviously as well, part of Carers WA also have the Aboriginal liaison services part of their role as well. So obviously we do encourage people from Aboriginal and Torres Strait Islanders, because we have got a culturally appropriate services as well within that resource. Next slide, Amy. Ivan.
Yeah. So we, during our time working with patients who are living with PKD, we understand that they shared a wide array of feelings, you know, most often feeling quite confused and overwhelmed when navigating through the complexity of their management of PKD and also processing all the healthcare information along their healthcare journey. And we noted that sometimes a lot of patients share the feeling of loss and anxiety, especially with the unavoidable progression of PKD and also the uncertainty of their future. And that would have a really great impact on someone's mental health. And we understand from a more younger cohort patients who live with PKD that also have shared with us about the additional stresses when it comes to thinking about family planning and to consider the probability of whether the chances of passing on PKD to their future children. And so part of our role as social worker, but in what Alison is saying, providing the emotional support, not only to the patient, but their carers, we also, from social work, want to promote and can give you support with healthy adopting behaviour to manage all those your emotions and mental health as well. So we understand that sometimes during our time or assessment with you, we might look into what are your coping mechanisms at the moment. So we know that there are often at-risk behaviour such as, you know, smoking, unhealthy dietary input that might impact your kidney and overall health. We can give you sort of coping mechanisms and sort of recommendations like grounding exercises, We can provide you with linkage with engaging with different physical activity, like talking to physiotherapy, and we can also provide you with mental health support. So a good support that you can access is either your mental health care plan through your local GP, where you can access up to, I think, 10 sessions to see a psychologist that could be bulk billed, or we can offer you resources and linkage with telephone counselling services as well, just to explore other healthier coping mechanisms, while acknowledging that all the additional stresses and anxieties that you might go through across the time living with PKD as well.
Sal, you want to comment?
Yeah, I mean, the other, from a mental health point of view, from the patients when I see them for the first time, we also have access, which I'm pretty sure over East do too, which is, they're called MindSpot GP. They're a company that was developed through Macquarie Uni, and they offer online psychology support for patients, either online or telephone. I do use that service to refer some of my patients in, and the reason why it's been so useful in this space is because it's not another physical appointment that someone has to attend on top of all the other physical appointments that someone with a chronic illness has to attend. So that's been quite valuable in my space with some of our patients, and some of them I refer in and they continue on with the program through MindSpot GP. Others, they just want to know that it's there for when they need it, and I can refer as a health professional, but they can also self-refer as well. Thanks, Ivan.
No worries, thank you. I guess another key area that social workers can provide or add value across living with the chronic illnesses is to plan for the future, which is sometimes a pretty important thing to do when we're acknowledging all the other uncertainties that you might go through, unsure of the progression of PKD. So what we can normally look at, working in conjunction with yourself and your family, in our role as social workers, is look into whether you have these future planning documents drafted. For example, whether you have a will in place. And I know it's a really scary thought about a will, but we always recommend anyone across different ages to consider them. And another two important documents we normally look at is, enduring power of attorney and enduring power of guardianship. So those documents often come into play when someone lost capacity, meaning they might be confused or unable to make decisions to consent to different things. So for example, under enduring power of guardianship, that could do with things such as your treatment decisions when you're in hospital, services, or where would you going to live, things like that. You can appoint someone either solely or jointly to manage those on your behalf, should you ever lose that decision-making ability. And equally as important, we normally highlight enduring power of attorney as well, which is in the same context of, you can appoint someone that you trust to manage your financial decisions for you. Should you need to, if you ever, let's say, get confused or unable to make decisions, someone can access your bank account to pay for your mortgage and pay for rent payments and things like that, which is quite important to consider. Which will also help to, I guess, minimize some of those stresses that you might be experiencing alongside your PKD journey. Other things that we normally would look at, more so in a hospital social work perspective, if you are in hospital, is Advanced Health Directive, and also talk a little bit more about decision-making hierarchy in the context of, whether if you have enduring power of guardian or enduring power of attorney in place, they're normally how would they rank in terms of other sort of individuals that could provide that substitute decision-making for you. So that could mean if you are in a hospital setting, you are really unwell and you can't consent for treatment. So if you have someone appointed for enduring power of guardianship, that would normally be near the very top of the decision-making for you. And in situations where if you haven't had this paperwork drafted, then under the hierarchy of decision maker, there's a range of different people, for example, your spouses, your children, who can make those decisions for you, and they'll go down one by one. And your social worker on the ward, both more so in the hospital social work, can guide you through these processes, and just to have this future planning paperwork sorted and start to plan about that as well. Yes, yeah. And the legal issues, it does vary from state to state. So we do encourage you to look for your relevant government organisation to clarify that. So right here in WA is under Office of the Public Advocate. Yeah.
Michelle, do you want to say about you?
Yeah, I mean, with advanced healthcare planning, often I'm the first one to start those conversations with our patients here at Charlie's. And often I start the conversation, and that's when I do use social work then. So I usually contact Ivan or Alison, and we set aside some time where we meet with the patient again face to face. And we sit and have a conversation together about what that looks like for that individual. Obviously, for me, most of my referrals into social work in that space are for those patients that are choosing not to go down the renal replacement therapy pathway for many reasons. And I will always tap in with social work for those conversations so that they can be a holistic conversation with the patient, their family, about what that looks like for them.
And I think for us, we try and differentiate between the Advanced Health Directive and Advanced Healthcare Planning. So the Advanced Healthcare Planning is more about the patient's views and wishes, you know, if they're getting to that end stage of life and how that would look for them, so they can plan that in advance, you know, if their health deteriorated, you know, and, you know, they were getting to the end stage, where would they like that to happen? What type of environment would they like to be in? Who would they like to be present? You know, do they want music playing in the background? You know, it's just how that person sees that for them, and everybody is individual. So, and the Advanced Health Directive is more, you've got to sit with your doctor, and they then will talk you through, right, when it gets to this stage, this is what may happen, this is what we can offer, what do you want? And it's up to the person what treatment or no treatment, and that can get worked through. And that's a legal binding document. So, yeah. Next slide.
Okay, so so we just want to highlight, I guess, there are some, I guess, misconceptions sometimes about the role and the scope of social work, and often, you know, what we do and why you will refer to social work. I guess what we really want to enforce is we try to empower anyone that we come across with. We provide emotional and practical support for you across your different healthcare management needs. We as social workers, we don't take over your life and do your planning and coordination for you. And we also unable to resolve everyone's issue all at once, but we can provide you with linkages and resources, and, you know, arm you with, you know, understanding what you can access in the community throughout your journey as well. Especially, I guess, with the scope of hospital social work, we often have a quite, I guess, clear boundaries on how we support. So, for example, we, for patients who would like to explore whether they might be eligible for NDIS, oftentimes you might find hospital social workers might not have the part of their role to have the resources to provide you with direct support to submit an access request, for example. But what we can do is we can direct you to the appropriate community support to navigate that through. I guess one of the key messages we want to highlight is, depending on which social worker you come across in hospital or in community, we always encourage you to reach out and ask us if you have anything that you're not sure about. And even if we're not the right person to guide you through, we can let you know who would be that person might be. So we do want to encourage you to reach out whenever you can.
I think as well for us, it is about providing the information, the guidance, you know, and that support. We're also a strong advocate for people or patients and families who just don't feel strong enough to advocate themselves, and that's sometimes advocating to their treating team, you know, to make sure the patients and their families' views are heard and listened to. And obviously the treating team can only advise you from a medical perspective, but when it comes to it, it's the person's individual choice how that health and what treatment that's going to look like for them, and whether that's that pathway they would like to take. So I think it's important, because we know some people, when they're unwell and, you know, if they've got pain, you know, and they're just feeling, you know, their health's deteriorating, they just don't feel strong enough to stand up and speak out. So I think we're very good at that as social workers, is standing up and supporting it and being that person's voice. One of the ones we don't do, which people some reason think, we don't have access to houses or property. We don't build properties that sometimes you've been asked. So that's always one that people think we've got access to accommodation or a house if people are maybe being evicted. We can link people in with the appropriate services and support them fill in the proper paperwork, but we can't access that. We also don't have direct access to Centrelink. Our welfare officers have contacts, but usually we can support the person, get all the paperwork collated for them, but Centrelink prefer to speak to the person, but we can be there to support that. And what we don't have access to unlimited funds. You know, we do have some funds that we can support patients with and their families, but it's not unlimited, so we have got some boundaries on that. So that's some of the miss, but I think a take-home message is for MD, regardless of where you're living, always ask. If it's not clear whether they offer some of the supports that we offer here, ask. Because it just might be known as a different, call it under a different name, but if you don't ask, you're never going to know.
Look, and I guess, you know, as a summary about the role of social work and how we can provide support for you across your PKD health management, you know, you can, obviously your healthcare professional, your pathologist or your nurses can refer for social work, and we have put some key indicators that what that could look like and how you can access support from what we discussed today. Or even across your healthcare management, if you have experienced any of this before, for example, if you are finding it a bit harder from a pain perspective to manage your personal care or do your shopping or do your laundry, if you are really worried about, you know, you are not able to afford medications or your mortgage payments, for example, from everything else that you have to pay for, if you are worried about housing, so for example, you know, you are in a private rental, you're at risk of, you know, can't find anywhere else to live, or even just simple for yourself or your loved one want to talk to someone about knowing what you were going through across managing your kidney disease, you can always reach out to social work and have a chat to us as well. And especially we want to highlight what Alison is saying before as well, for we acknowledge the incredible role that carers play, could be your partners, your children, your extended family, to your loved one. You are eligible and able to get support as well. And I understand carers normally don't put their well-being first for the person they care for. And you can also reach out to social work and we can provide you with linkage and information about what support available to you. And like Alison said before, Carers Gateway across in different states. If you ever feel like you want to talk about family planning, or if you want to just maybe meet more people that go through the journey that you are going through right now, we can provide the support peer group, which is, you know, the beautiful organisation that's PKD Australia, and also like what Sally and Alison said before, we can offer you assistance with advanced healthcare planning across your management as well. So I guess if anything that is on the slide or not on the slide that you would like to have a chat, like what Alison is saying, reach out to your local social worker. We're here to help. And if you're not the right person, then we can certainly guide you through and link you up with the appropriate professional that you can access. Thank you.
Thanks, Ivan and Alison and Sally. That was tremendous. Lots of information, as you said, when we caught up earlier, but we're certainly happy to send that out to people for clarification. If they've got any more detail they want on anything in particular. We might just take a moment to answer a few questions and clarify a couple of things. I'll deal with the questions from our attendees first. And the first one is back to that carers payment or that assistance area, Alison. At what stage of PKD is someone able to apply for assistance? That is things like NDIS, Centrelink, carers allowance. At what stage does that come into play?
I don't think there's a stage. The minute you start providing support, so if somebody's even just been diagnosed and it's just impacted on them emotionally, that you need to be there to support them, encourage them. Some people just lose their confidence the minute they've got a diagnosis. That carer support starts there and then. The minute somebody's diagnosed, you don't need to wait till their health deteriorates or their mobility reduces. But, and if you are having to bring them to and forth to their appointments, when they've just been diagnosed, and obviously when they're getting more information and then obviously options provided about potential treatment that could potentially be offered to them, obviously at Sally's journey point, that can start. You don't need to wait. The carer's allowance is just the minute you start providing any kind of carer support.
Yeah, that's interesting. Just from my own experience, as we've discussed, Alison, and I considered myself fairly well plugged into lots of resources, but I had no idea until a couple of weeks ago that carer's allowance was available under such, I would say, easy terms. Perhaps, the fact that it's not asset tested, and if you're earning over $250,000, then you're not eligible. But as you rightly pointed out, there's not too many people in that situation. So realistically, I could have applied for that 10 years ago, and so that's an amazing piece of information. And I'm sure there will be plenty here that are also agree. And it is a carer is an interesting role, because you, as you rightly pointed out, you often don't identify yourself as a carer because there's almost a stigma attached to that. It puts the patient as a patient. It puts you as some sort of parental figure, which you may not be. You might be a husband or a wife or a brother or a sister. So it's, that's really an amazing thing. And look, $144 a fortnight is not to be sneezed at. So thanks. Hopefully that answered the question for Jenny. We've got another one here from Gabby, and Ivan, I think you were just talking about the mental health care plans that a GP might be able to provide. You mentioned, I think, and Gabby thought you said that it was if you go through a mental health care plan like that it is bulk billed. But Gabby's saying she wasn't sure that was the arrangement that she was under. So can you clarify anything about that?
For sure. I think my understanding is there is up to 10 subsidised sessions that you can access to see a psychologist per year. Oftentimes, the bulk bill services are quite difficult to access or with extended wait lists. So there might be circumstances with other individuals who might access mental health care plan but need to have a top-up fee that they need to co-contribute to other private billing psychology support as well. So that might play a part into additional finances that you need to factor in when accessing that. But certainly there are available bulk bill psychologists, but we acknowledge that their waiting list sometimes could be quite lengthy. It's just the demand and lack of available bulk bill support. But sometimes here in WA, there are other, lower cost access to psychology support as well. For example, in University of Western Australia, they have student psychology clinic or professional psychologists that offer $40 session psychology support that you can access and tap into. So it's depending on, if you feel that is some service you can access, there might be lower cost psychology support that is still cheaper than paying a top-up fee, accessing other private psychologists who might take subsidies from the mental health care plan. So have a yarn with your GP, have a yarn with your social worker. They might be able to guide you through further whether those options might be available to you.
And Sally, your mentioning of MindSpot GP, how does that come into play when it comes to bulk billing or anything like that?
Yeah, so it's a free service. Yeah.
Right.
So
Okay.
yeah, it's a free service. And I think the other thing to remember too, because obviously this webinar will be is from everybody from different parts of Australia. Some renal units actually do have psychology support as part of their renal team. So it's worth asking the question as to whether they do have psychology linked in with the renal team. Unfortunately, we don't. We wish we did, but we don't. But some units do. So it is always worth asking that question. Yeah.
And I think
that's-
adding, I think adding to that as well, for patients who might be working in some capacity at the moment, is worth checking with your work whether they offer any employee assistance program, whether they do free psychology support for you as well. So if you check with your work employer and look for EAP, and they probably is another good resource that you can tap into with shorter wait list.
That's a great reminder. Those services are often able to be extended as well. So if a person goes through 4 sessions or something and needs more, then often those employee assistance programs do offer those extended services. So that's, a great point.
And it's also good to remember too, there are some psychology services here in WA and some counselling services that are walk-in clinics. We have one near our Midland Hospital here. Obviously, for the younger person, there's Mindspace and all of those places that offer free walk-in psychology. It's probably worth going to your Department of Health website to see what's actually available. Or again, use your wonderful social workers to ask them what's available in their area.
That leads us to another question we've got in terms of areas. Dave's in northern New South Wales and keen to find a social worker that might have some specific knowledge of PKD, like Alison, Ivan, and obviously, with Sally's input and as well. There doesn't seem to be a great deal of support in that area necessarily. So have you got any thoughts on how he might be able to access something or find someone with a bit of PKD experience?
So I think the closest territory hospital, whether his treating doctor for his condition could do a referral to one of the big territory hospitals, and he can get an outpatient telehealth conference. He doesn't need, if he's distance-wise is stopping him making contact. We can do telehealth with patients for rural areas, and we tie in with them that way to save them having to come down to north to the metropolitan area just to have a chat with us. Do you know what I mean? We can either do telephone consults, telehealth consults, but his treating team could do a referral to the social worker linked to the main hospital and see if they could support him with that.
It's my understanding that the northern area of New South Wales often comes into the PA hospital in Brisbane in terms of, the transplant and the big renal areas, and also the Royal. So you're right, then that might be something. I'll drop my email for Dave to shoot me an email, and I'll see if I can speak. I have spoken to some social workers at the PA, so that might be helpful as well. So just a comment from Shane in WA, thanking you all for the useful information, and Gabby as well, saying thanks very much for the information that you've shared tonight. There's a couple of other things in the couple of minutes we've got left. Sally, we sort of just jumped over to you every now and then for expert Sally advice, but would you like to just share with everyone where you come into the process, and then how you then facilitate that referral on? I know you did talk a little about it, but we didn't really talk about where you come in.
Yeah, so, obviously my role here at Charlie's, and there is usually a my role in most tertiary centres across Australia. And my role here is to talk to patients about dialysis therapies and help them with shared decision making to make a decision for them as far as kidney replacement therapy. It's also, my role is also to talk to them about their chronic kidney disease management as well. Where I then step in is, it was interesting looking at the slides that Ivan and Alison have put up, because part of my assessment of someone when I first meet them is looking at their environmental, interpersonal and intrapersonal, and all those things that were covered in that previous slide of Alison and Ivan's are things that I look for with my patients, because they give me cues on whether I need to then tap into Alison and Ivan in regards to needing more support. So, in this pathway, I'm often the first person that the patient may have seen in the tertiary setting other than their treating doctor. So I am then the person that will then refer in through to social work when that person and their family requires more support in any of those domains. And I think here we are very fortunate. We work very well together, and we are also involved in multi-clinics together as well, to again provide that support to patients that hopefully limits some of the multiple appointments that people have to make when they're dealing with a chronic illness. So that's kind of my role, where I sit in all of that. And I think, we were talking yesterday, Amy, one of the take-home messages from my point of view at this end of the table is, for me personally, I always give my card out to patients that I see. If you get given a healthcare professional's phone number and email, use it how you need to use it, because I am an access to these good people. So I am always happy to take emails and phone calls to say, Sally, I'm not coping, or my housing situation has changed, or my partner, my husband, my mother has become more frail, we're struggling at home. And then I will then send that through to Alison and Ivan, so that people can get the help that they need to live well at home.
Yeah, that's great. And it's a really good point, because sometimes healthcare professionals do provide their direct phone numbers, and that, as you say, that's a sign that you're ready to receive those phone calls and happy to do that and help people.
Yeah.
The journey of PKD can be an interesting one for young people. Obviously, if they've seen some of that family history of polycystic kidney disease, and then they might be getting to their mid to late teens, early 20s, and find out that there are some issues coming their way and that they've inherited the condition. So what's your perspective on what a social worker might be able to help someone at that stage, when the disease and illness is essentially invisible, and for a lot of people it remains invisible? So how might you support somebody from that point through to perhaps end stage?
I think from a social work perspective, a lot of our role is supporting people with that adjustment. So when a young person has been just told, and as you said, maybe a previous family member has had the condition, they know what the trajectory might look like, although everybody's journey or pathway is different, can be slightly different. So it's because it's technically like a loss and grief. Young people just think, I've got this condition, my life's over. So supporting them, obviously, process the information, and people need time to process that. Sometimes here we've got people who are referred the minute they've been diagnosed, and we're like, nah, it's not a good time. They've not even processed what they've just been told. Let them process, let them start thinking questions, then let us start that support. But it is managing and supporting them through that adjustment period. Sally's in at that initial stage when they're talking about maybe treatment options, so she does all the medical knowledge and information. But I think it's looking at you know, for a lot of young people, it's about body image, you know, body, especially if they're having to start dialysis, you know, body image issues, you know, family planning, will they be able to have family? Is that going to impact? Am I going to pass this on to my kids if I have kids? So supporting them through that whole process. And for some of them, it's us providing a safe space to let them speak their concerns, you know, vent if they have to, and be supported. And obviously for me then, they're able to then manage better mentally, you know, they're able to digest the information. But it's that stage. Some people are very angry. I've had a young person very angry, and it took time. I mean, it took a lot of contact and, you know, to take time, because he just, So, you know, we're here to support them and see what I will say. We don't know everything, Amy. We don't have the answers for everything. Always up front, if I don't know the answer, I'll say I don't know the answer, but we'll go and try and find the answer. You know, so.
And I have some young PKD patients who they need us at different times, and it's not always their disease progression is the reason they need us. So we actually do have patients that I will tap in and out with the social work at different times of their life when their needs are different, and we understand that. You know, they may be on a very long road where it's just sort of sitting there in the background, and they've just got other hurdles in their life that present themselves, or they've had a period of unwellness, and so their needs are different. We're very aware of that, and we don't have a limit on how many times I tap social work in for any patient that needs that. So we're very conscious of that.
Yeah, that's great to know, and it's something that I think people probably wouldn't really realise, that from the moment, I guess, they're introduced to you or any of you, you can pop in and pop out as often for whatever reason, perhaps, and you're able to facilitate pointing people in the right direction, which is a great opportunity, and certainly for carers as well. So. I've written down a few things that I've taken away, key takeaways from today. One thing, obviously, is that carers allowance. That I think is a game changer for some people. I think Sally's MindSpot GP reference is quite amazing. So if you've got any information on that, Sally, you can send me, and then I can pass it on to anyone. The other thing was, I like, Alison, you just said just ask, you know. I know that social workers are always willing to help, and so it's just a matter of asking. And sometimes we feel vulnerable in healthcare situations and don't feel confident enough to ask, but it's nice to know that people like yourselves, all three of you, are willing to listen. The other one that we touched on, but it's a big one for a lot of people, is the PBS pharmaceutical scheme. And, you know, I could really encourage people to have a look at that. One of the sort of nuances of that benefit is that it's almost essential that you see the one pharmacist. And that may be, you know, just happening for you anyway, but a lot of people go, oh, I just need a script, I'll go to that pharmacist and I'll go to that one over there. But one of the nuances with that benefit is that you sort of, it's really helpful and much easier if you can do that at one pharmacy. And if you hit the limit, then your prescriptions drop from, you know, whatever they normally cost down to, I think, in the vicinity of $6-7. So, those resources are excellent as well. So I think that is all. Well, it's all our time, and I think we have answered the questions. And I'm so delighted to have, you know, had you three and the effort and time that you've put in to share this information with us. And if you're open to me sharing the PowerPoint presentation with people, then that would be great. And certainly, you know, if we can reach out to you for a bit of advice here and there. So on behalf of the board of PKD Australia, and in particular myself, because we've enjoyed some good meetings and some heartfelt conversations.
We have.
Thank you very, very much. And to everyone out there in the webinar, I sincerely hope this has been of significant benefit to you. Certainly has been something that I was keen on us being able to present. So I hope it's been good for you. So thank you all very much. Everyone stay well, stay warm, and we'll say good night.
Thank you. Thanks for having us.
Yeah. See ya.
Thank you very much.